Hi everyone, my name is Smitha Antony. I'm currently studying postgrad in mental health nursing in University of Tasmania. Today I'm going to discuss about mental health issues in young family related to working from home and homeschooling due to COVID-19 lockdown. Working from home with kids for a long period of time can slowly start to affect the mental health. If someone is feeling overwhelmed or finding difficult to cope during the lockdown, it is important to ask for professional help from someone who is trained to look after people's mental health. With young parents who are working from home and also homeschooling at the same time is a real struggle. It is important to know how to balance life while working from home and teaching kids at home. There are different measures that can help young parents to tackle the stress and look after their mental health. The common feelings that young parents experiencing during working from home are feeling isolated, lonely, or socially and professionally disconnected from other people. There might be some difficulties to stay motivated, insomnia, and other sleep problems. Sometimes people experience anxiety, anger, frustrations, irritability, mood swings, feeling overwhelmed, loss of appetite, muscle tension, and headache as well. It is important to monitor the mental state of young kids who are studying from home during the lockdown. Monitor for any behavioral changes like being withdrawn, irritable, or inflexible, and check for any emotional signs like anger, frustration, and anxiety. Sometimes children show physical symptoms like headache, nausea, digestive issues, abnormal sleep patterns, etc. So the number of divorces is dramatically increasing during the lockdown as well. The number of domestic violence has been dramatically increasing since COVID-19 lockdown, and it is very dangerous for other family members to stay with violent partner. The people who are working from home also experiences increased workloads, new work streams, and more caregiving responsibilities, and that leads to mental health issues like addicted to alcohol and other substance abuses. There are some tips to protect mental health of people when working from home and homeschooling children. Set up a structure and a routine for workday and create boundaries between work time and home time. Try to create new routine as a family to help separate work and school time and family time and accepting the fact that it is the new normal. It is important to create a specific place in your home where you work. Avoid working from bedroom if possible because it may interfere with sleep pattern. Practice self-care and mindfulness to relieve stress at home. If family stress and work become a problem, the first step in managing stress is realizing that it is a problem and make connection between the behavioral, physical, and emotional signs. It is important to take a break between work to feel disconnected. It is important to find new ways to connect with family and relatives. The best ways to keep in touch with them are FaceTime or social media. However, it is not a good idea to have unfettered access to screens like social media because it may amplify the level of anxiety. Find ways to entertain yourself during lockdown. There are some distractions and hobbies that can help parents and adults to get distracted from workload and family stress. Start healthy habits like gardening, exercise, reading books, or take this as an opportunity to look after your mental and physical health. In Australia, the government is providing support to the people in different ways. The government is providing 10 additional Medicare subsidized psychological therapy sessions for people subjected to further restrictions in areas impacted by COVID-19 pandemic. The people will have to have mental health treatment and a crisis plan and frequent review with their GP to access the additional sessions. This will allow the people to continue to receive mental health care from psychiatrists, psychologists, GP, or other eligible healthcare workers. There are some information about how to access different kinds of mental health supports in Australia. It is important to seek help if struggling with work and also homeschooling kids at the same time. There are so many digital mental health services that anyone can access online or over the phone. If parents are struggling during the lockdown with kids, they can contact Parents Line or Men's Line Australia. If children need extra support, Kids Helpline is available to give them counseling. If people are getting stressed due to financial difficulties during COVID-19 outbreak, it is important to find out what are the options are available. National Debt Helpline offers free financial counseling for those who are financially affected during the pandemic. If parents are stressed about the health concerns of their children or other family members, access information from reputed resources like Australian Government Coronavirus Health Alert, Health Direct Coronavirus, Smart Traveller, or World Health Organization. Head to Health is committed to provide digital resources in Australia to help and support the mental health and well-being during the pandemic. Victorians can access additional mental health support with 15 new Head to Health mental health clinics opening to public. The services provided on-site are free of charge to all the people attending the clinic. There is some gap in accessing the available resources to parents who are working from home and homeschooling. Parents are unaware about the resources that are available to them to tackle the difficult situations during this pandemic. So providing education to the parents through schools where online is the best way to deliver the information. Another way to provide information to all workplaces from the government through email or other communication systems. Media plays an important role in delivering information to the community, and it is important to keep updated with the information. There are some community initiatives to help parents working from home and homeschooling. Global health guidelines already emphasize the importance of community participation in global pandemic. Incorporating the ideas from communities is vital for co-production of health, where health professionals work together with the community to plan, research, deliver, and evaluate the possible health promotions and healthcare services. Provide adequate mental health support to the persons who are in isolation. Deliver the necessaries to the doorstep via contactless delivery service is an initiative from the community. A government should immediately set up and fund specific community engagement task forces to ensure that community voice is involved in responding to the pandemic. A national campaign has also launched to keep update all Australians regarding coronavirus pandemic. There are some barriers to access the mental health facilities in young families. The stigma regarding mental health issue remains the first reason. The fear of getting infected with coronavirus is another reason for people not to go outside. The restricted access to mental health care is another reason for people not to get access to mental health services. Some people are feeling unable or uncomfortable to use phone or video call technology. Younger people are more comfortable with technology. However, they are nearly twice as likely to say that they are more uncomfortable to use video call technology to access mental health services. Some people get disappointed due to the frequent cancellations of appointments. There are some other barriers like high cost of psychotherapy and childcare services are very difficult for the families to access. Please have a look at the references that you can get access to all the information. Thank you.